Well, it is no secret that drugs, opioids especially, and now especially fentanyl, have reached crisis levels across Washington, across the country. Snohomish County is not exempt from it at all, and that's why County Executive Dave Summers has issued a new executive order to take essentially a county-wide approach to tackling this crisis. And we are grateful to County Executive Summers for joining us. Mr. Summers, let me start by asking you to tell us a little bit about your plan.
Yeah, thank you, Ryan. And the plan has several parts. First of all, we actually created a group, what I called a multi-agency committee, before the COVID crisis to deal with opioids. And we've all been through COVID, and our attention was elsewhere, and it's now very clear we've got to reinvigorate those efforts and up our energy to address the fentanyl and other drugs that are just really flooding our communities. It's quite terrible. We're losing a person a day to overdoses. King County, I think, is at 2 people a day, last I heard. The problem's only getting worse. These drugs are flooding. They're cheap, they're small, they're readily available, and they're just affecting many people's lives. And also COVID, a lot of people, more people are homeless now than before, and it's just compounding the problem. So the plan is to reinvigorate our multi-agency committee, bring in law enforcement, cities, nonprofits, and others to coordinate under emergency management framework to address the crisis in front of us. We also have an opportunity to now have some dollars that are coming out of the opioid settlement agreement, and we've got $1.4 million as a start now to put towards this plan.
Now, did I read correctly too that is a 17 years of payments from the opioid settlement, and it looks like Executive Summers. Is that your dog, Mr. Summers?
I just closed the door. She went out barking at a delivery person.
Well, they're good to have around. Doesn't matter when they act up a little bit. But I just wanted to clarify too that I read correctly. We are expecting money over 17 years in payments from this opioid settlement. Is that right?
The first wave that we have certainty on is about over 10 years, and we've received $1.4 million for 2022. The entire amount that we are now expecting, that we know for sure, is going to be about $12 million over 10 years. But there are other settlements, there are other negotiations going on, other lawsuits, and so we expect that there will be some more, but this is the first wave.
What are you going to use some of that money for?
Yeah, so in the short term, our proposal that we just sent to County Council today is to fund making sure that we have naloxone out in the community. It's readily available to the public and to first responders. We know it saves lives. If somebody's in throes of an overdose, it can save their life. And then we can start to help them try to get stabilized housing, shelter, etc., and really try to get them back onto a productive path. The other part of the plan is really to get dollars out to many of the organizations that are already working in this space, that are providing services of many different types. So two-phase naloxone, dollars out to those that are already working the space. We don't need to recreate new organizations. We've got organizations working on it that need resources. In the long term, we want to develop an education program to go out and talk to, frankly, in schools, to prepare kids for facing this in their own life. There isn't a kid going through school now that won't at one point be faced with choices, and it's all around them. It's in schools, it's everywhere. And so we think an educational program has shown to work in other places, and that's something we want to fund in the future. And also a mobile resource group, facility that can go anywhere in the county quickly to help when people are in crisis.
Now, that's something I wanted to ask you about, because it stood out to me as an interesting piece to this. multifaceted puzzle. And when you're talking about a mobile unit, are we looking at something similar to what like Seattle is doing with Health One?
Yeah, yes, it's a takeoff on that, but we have not had those resources here in Snohomish County to be able to have that kind of sort of quick response type of unit that is specifically designed for people in drug crisis. It's a specific type of situation that needs to be dealt with appropriately, and right now we're just asking our first responders to deal with that and car accidents and all sorts of other things. And so there's enough of a demand that we think a specialized mobile force would be a good idea.
Now, I know part of your directive to the Department of Emergency Management is for them to coordinate all these agencies coming up with plans and strategies and goals with deadlines ranging from 1 month to 3 months to 6 months.
Yep.
So it's a whole of government approach, isn't it?
You know, what we're doing is we're taking a system that has been developed over many, many years at the national level to help communities respond to emergencies and disasters like landslides and floods and earthquakes. It's an emergency management structure that all counties, cities, first responders are all trained in because it's already been thought through. And how do we organize different agencies with different goals and different objectives and just different resources and talents? How do we organize that quickly to respond to an emergency? So we're using that structure to address the crisis before us, the drug crisis. And really, we're expanding that now to make sure that we have all the partners in. It's shown to be effective in emergency situations. This is an emergency. It's not a short-term emergency. It's going to roll out of a long period of time, but the structure is there and everybody understands it and agrees to it going in. So what we can then do is focus on who is doing what resources do they need to get it done. Law enforcement has one role, human services, social workers have another, nonprofits have another, and so it's really getting us all together. Say this is the plan. These are our objectives. This is how we get there together quickly and efficiently.
Well, it's also no secret that one of the things I should say that we're going to need to tackle this crisis is more drug treatment and places for people to go. And because there's such a nexus there with, the drug problem and homelessness, obviously people who don't have a place where they can be when they're recovering, it makes recovery next to impossible. Now, I was over on Everett Mall Way the other day. I know that the county bought that motel that was right there. It's still fenced off and sitting idle. What are we doing to get places for these people to go?
So we've bought 2 motels with federal dollars. They're both being renovated. Both, and we knew this going in, had been contaminated with methamphetamines, I believe, but they have to be reconditioned. We knew that going in. Almost any hotel has that possibility these days. The drugs are so pervasive. So they will hopefully be coming on towards the end of the year, first part of next year. We have to have many tools. Law enforcement is one tool, but we know just arresting somebody and locking them up does not solve the problem long term. To really get back on a path to productivity, these individuals need to be met where they are, who they are, where they're coming from. In some cases, they might have gotten into drugs through pain control. That was really big early on with prescription opioids. A lot of people that took those got hooked on them. There's mental health issues. There's homelessness. There's joblessness. There's all kinds of traumas that can get people to a point in their lives where they're turning to drugs and have turned to drugs. So our goal is to work with the individual, get them shelter, get them food, get them stabilized, but then right along with that come the services to help them. And we give them choices. You've got a choice. You can live, frankly, and work with us. We'll help you with this. Or the other choice, frankly, is to keep doing what they're doing, and we're seeing just people die from it. We want good choices for these folks, and to be able to really realize they're individuals They're people that have talents and they have families and friends and histories. And, I lost my brother 2 months ago to fentanyl. He had been clean for over a decade, had struggled with drugs early in his life, really all stemmed from early childhood trauma he had. But, we just need to understand and help the individuals as best we can and help those individuals, particularly that want to be helped.
Yes, and I'm incredibly sorry about your brother. As I mentioned, I recently lost a cousin under similar circumstances, and that's something I definitely wanted to ask you about, because it's not just that you are seeing this all around you; it's personal for you, and it's gotten personal for all of us, hasn't it?
It's affecting so many people. It's just kind of overwhelming sometimes, but it's really important that we talk about it and we recognize that these were good people and they have families and they had a life in front of them potentially, and through many different means, sometimes just bad choices, but sometimes other traumas that affect them. We just need to know it's affecting not only those individuals but their families and our communities and our businesses. It affects us all one way or another. You can't drive through downtown Portland or Seattle or Everett or anywhere, frankly, in our communities without seeing kind of what is how this is negatively affecting people and communities. And so it's kind of a number one problem for us that we've got to address together, and it's complex.
Well, you mentioned the word choices a couple of times, and the one other thing I definitely wanted to ask you about is, are we to a point, because it's having such a negative effect on communities around us, where if people choose, either come with us and get help, or no, I want to stay here and keep doing what I'm doing, are we to a point now where, and I'm not saying we should arrest people and put them all in jail, because you said it, that's not the solution. The governor the other day said, with the Blake bill fix, maybe it's, arrest to treatment rather than arrest to jail. But are we to a point where when we offer help, we're going to stop taking no for an answer?
Yeah, well, I think it does need, if when there's arrests made, there needs to be treatment to go along with it, because we know locking people up for a short period of time and then putting them back out on the street doesn't work. It doesn't solve the problem. So there has to be treatment, which means you have to have the facilities to do that. The state kind of dismantled our mental health care system at the state level many years ago. I think the thinking was, we have new drugs to help people with their problems, and we're going to fix all this. We don't need these institutions anymore. Well, turns out we do. They probably look different than the old institutions. We have to give people help, or it's not going to get at the root of the problem. And helping somebody that's in addiction is not a quick, easy thing. I use the example: if you've ever tried to lose weight, the draw of food. And if you have a particular craving, the cravings for those things are really difficult. Well, drugs are, 10 times worse. If you, somebody that's addicted to an addictive drug will take the drug over food. I mean, that the urge is that strong. So it's a very difficult problem, but in the end, the only way we solve it is by helping those individuals and give them that choice to be helped, which means we have to have the facilities to help them.
Agreed. And the food analogy is great, because you're talking to a guy ready to start yet another weight loss plan. So
Yeah.
no, I totally, and I,
Yep.
and I used to be a smoker. So
Yep.
I totally get how that works. So the one last thing I want to ask you too is, what can we as a community, because I live here in Snohomish County, and work in King County. What can we as a community do to help you with this effort?
Yeah. Well, I think talking about it and talking about it with family and friends and bringing it out in the daylight is really important. We have to cite these facilities somewhere, and we get a lot of pushback from neighborhoods, and I understand that. But in my view, having a facility that's helping people is preferable to having those people that need help out on the street. I mean, that's not good either. So I think people need to understand that we have to cite these facilities, we have to create these programs, and and we have to destigmatize it. As I said, these are good people. They deserve help. The families deserve help, and we all, as a community, have to get to come together and say this is good for all of us. And we understand whether it's a county or a city or whoever is working on addressing this issue, we have to give them support.
All right, very good. Snohomish County Executive Dave Summers, thank you for taking some time, sir.
Hey, thank you so much, Ryan.